Good evening, everybody, and welcome to this webinar, where I'll be providing a briefing on the establishment of Medicare Urgent Care Centre in Maroubra. My name is Brendan Goodger, General Manager for Primary Care Improvement. First of all, I would like to start by acknowledging the traditional custodians and sovereign people across the land in which we work. I recognise their continuing connection to land, water and community, and pay respect to elders past, present and emerging. I also extend that respect to Aboriginal and Torres Strait Islander peoples joining us here tonight. Really encourage people to fill out the General Practice Workforce Planning Survey. So we're really seeking your views on the areas of greatest need of GP services. It is a really, really important survey. And it'll really help build the evidence base and inform the distribution and placement of GP registrars to try and meet the current needs for the GP workforce. The survey is going to close on the 30th of July, but we need more responses. So hit the thumbs, hit your keyboard, and please respond to the survey. Now, I'd also like to acknowledge that we've got the chair of the CESPHN board attending tonight, Dr. Michael Wright. You also have some of our CESPHN board directors in attendance. My thanks to them. We also have our member chairs attending tonight as well, and I acknowledge Dr. Hilton Shapiro. And also we've got our CESPHN CEO, Ms. Natalie Hanson, attending. Great to have you here, Natalie. And most importantly, we've got a large number of GPs, practice nurses, and also practice managers who are attending here tonight. And it's really fantastic to have you along tonight. And certainly want to acknowledge all the really amazing work that you guys do in the community, that you guys do for your patients. And I know it's been a tough few years with COVID, but I just want to say thank you sincerely for all the work that you do and will continue to do. And we're also looking, of course, to really get your support for the Urgent Care Centre tonight. I know you're all keen to hear about it. So tonight, what I would like to try and do is give you a briefing on the Urgent Care Centre, what we hope to try and achieve, how it's going to work, what might be like some of the benefits, and also about how it's going to interact in with general practice. So by way of some background, the Australian government announced the commitment to establish 50 Medicare urgent care clinics across Australia in October 2022-2023 in the budget. This was a very significant announcement. And the aim of it really is to try to ease pressure on hospitals to give Australian families more options to see a health professional when they have an urgent but not life-threatening need for care and are unable to access the usual GP or other care provider. I think it's really important around focusing on this. It's when they have an urgent but not life-threatening need for care and are unable to access the usual GP or other care provider. And we have been extremely fortunate in our region that the Commonwealth has identified Randwick as being able to have an urgent care clinic. Next slide, please. So we undertook a really rigorous selection process. When the Commonwealth said to us, Brendan, there's an urgent care clinic it's going to be in Randwick and would like the PHN to commission that, we went, fantastic. We would love that opportunity. And so, but what we wanted to do though was to make sure we had a really good selection process, give everyone an opportunity, to apply to be an urgent care clinic. So we put out an expression of interest, and again, those applications were reviewed by an independent panel that included representation from general practice, the local health districts, and those who have input into the emergency departments, And most importantly, we had a health consumer who provided some really great feedback. I can indicate that we've now completed that commissioning process, and we have now appointed 4Health as the provider of the urgent care centre that will operate from Maroubra. So we're really pleased to have 4Health to be appointed. Next slide. The centre is going to operate from 806-812 Anzac Parade, Maroubra. And it's part, as I said, of the 4Health group. Now, I've actually been out to the site a couple of times, and I've had a walk around, and it's a fantastic site for those of you who may know that, because it's got a couple of car parking spots nearby. It's got parking underneath. We've got the buses sort of whizzing down Anzac Parade. And of course, it's also relatively close, about 2.4 k's from Prince of Wales Hospital and of course Sydney Children's Hospital as well. So we think that it's got a really good location that could really support urgent care. Next slide, please. In terms of about 4Health, they are a very experienced primary care provider. I'm sure that many of you know them. They run a large number of general practices here in Australia. But critically, they're also one of Australia's leaders in providing urgent care. They've got 2 priority care centres, well, urgent care centres in South Australia. They've got 6 urgent care centres in Victoria. They've got 2 Medicare urgent care centres in Western Australia. Next slide. They've got about 6 or so in New South Wales, about 2 perhaps in Queensland, again, waiting different stages of contracts. And there are other submissions that they've got in play as well. So you can see that they've got a huge amount of expertise in urgent care, and that is absolutely critical to have credibility, but that they've got the systems and the protocols in place, so we don't have to start from scratch. Well recognised, well developed, well credentialed systems in place, but they have to say really experienced personnel who have set up multiple urgent care practices across Australia. And we're going to be leveraging off their expertise to guide the development of this urgent care centre down in our very own Maroubra. I'd also say too about 4Health, and I've had the benefit of having multiple conversations with 4Health, and importantly, it's not just 4Health, it's with the team, all right? With Simon and Richard and Michelle. I've got to know them well. And what's really come out from those discussions is their deep commitment to also providing care to priority population groups, right? But they've also said too, that first and foremost, what they are is a primary care provider. They run general practices. That is their business. That's what they care about. That's what they're committed to. And that's what they've indicated to me. And so for us, selecting 4Health, we feel very positive about, given their reputation, given their experience. So we are very pleased to have them on board. We've set them a pretty tight contract, I have to say. So if any 4Health staff are listening, we've got a big job ahead, all right? Next slide, please. I just want to run through just some of the benefits of urgent care clinics. And look, I could have a dozen slides up around this. I sort of kept it to one, all right? And those of you who know me know that I can talk a bit. I've kept it just to one slide. So the benefits are that urgent care clinics treat some conditions that are also perhaps sometimes managed in emergency departments. That's those people who may attend urgent emergency departments at get triaged at sort of category 4 and category 5. All right. So it's those people with, if you like, low acuity type conditions who, by the way, often present to general practice anyway. Right. But what's happened is that sometimes they can't get in to see a GP because it might be on the weekend. Therefore, they attend the emergency department. We know from the evidence that's emerging from other states is that those areas that have urgent care clinics have significantly lower emergency department attendance. Why? Because some of those people are making better use of their existing GP, of their current GP, and or they're attending their urgent care clinic. One of the other questions that I'm being asked is, so Brendan, what's likely to be the attendance? And the short answer is, I don't know. But what we do know is that in Victoria, there's been about 100,000 attendances across 25 urgent care centres in the last 6 to 12 months. That is a lot of people, right? It shows that urgent care centres are popular, that they are being used, they are getting a quality service. Interestingly, about 60% of patients treated indicated they would have attended an ED without the urgent care centre. So again, this shows that primary care is actually able to treat people with an urgent care need. And I think that's a really important to note, that primary care do see people with urgent care needs. They are able to be treated in primary care without necessarily having to go to an ED. The other benefit of an urgent care clinic is the opportunity to respond to local community needs. I think that's really, really important. We know what happens on weekends with different sporting events. And so what we'll be able to do is to tailor this clinic at Maroubra to better cater for the needs of that particular community. It will also increase access to primary care, because as I've said, it's also going to help by diverting low acuity cases back to GPs, not just those in the urgent care centre, but also to other GPs as well. So again, this is about mixing metaphors here. I'm sorry, everyone. It's about growing the pie. It's about increasing access to primary care. Next slide, please. So as I've indicated, urgent care clinics are now becoming well established. Now, the great thing about us developing an urgent care centre in Maroubra is that it comes after urgent care clinics have been well established in other parts of the country. What that means is that we're not reinventing the wheel. It means that a lot of the foundations have already been laid, that we can then take those learnings and apply them to Maroubra. We want Maroubra to be a success. We think Maroubra will be a success because we're going to leverage off what's happened in other states. It's really important that we all care deeply around patient safety. So one of the key areas is making sure that the urgent care clinics, they have to adhere to the Medicare Urgent Care Design principles. They have to also adhere to the operational guidance, and the Commonwealth have been pretty strict on this. And they've had feedback from GPs as part of those principles and guidance. They also have to adhere to data reporting requirements, and that's also quite rigorous. They also have to agree to provide all Medicare urgent care services at no charge to patients. Okay. Also, it's about having agreed escalation pathways with local emergency departments, principally in this case, Prince of Wales and Sydney Children's, and of course with New South Wales Ambulance. There's also been a robust evaluation framework that's been established. We want to assess the success of the urgent care centre in Maroubra. On top of all this as well, we have a contract now with 4Health that also embeds our expectations on what we expect from 4Health in terms of being a service provider. And we do a lot of commissioning here at the PHN. It's an area that we're very good at, and we're very good at monitoring performance. The other thing that we're very good at doing is also making sure that the service reflects community need. Next slide, please. So how will the clinic operate? Well, initially, it's going to be open for extended hours, 7 days a week, at a minimum, 8 to 8, Monday to Sunday, and also on public holidays. Now, what I would hope is that if there is a need, then potentially over time, we could extend those hours to go up to 10 p.m. But again, that's a discussion that we'll have to have with 4Health and the available budget and depending on need. The service will have imaging facilities on site, or that's easily accessible across all hours of operation. X-ray, ultrasound, CT. They'll also have timely access to laboratory-based pathology, all essential. It also has to have a designated area, and it will have a designated area for ambulances to stop and obtain ready access to the urgent care centre. And of course, be absolutely thoroughly equipped with the appropriate, equipment for diagnosis and treatment. Next slide, please. We might just go back one slide, guys. One of the other things that we're doing for the establishment of the service is making sure that it's ready. So tomorrow, I'll be going out to the practice to do, if you like, a practice readiness run through. And staff from 4Health will be there. I think Richard, who's the Director of Urgent Care Services from 4Health, will be there along with his team. I'll be there and we'll be running through and making sure it's fit and ready to be opened. All right. We have a specialist GP who's trained in doing these checklists, who's independent, who's doing them across other urgent care centres across Australia. They'll be in charge. They'll be the boss tomorrow. And we've had to fill out different surveys to assess the readiness of the urgent care clinic. Next slide. So the referral sources to the urgent care clinic, well, it could be self-referral with a booking or without a booking, i.e. that people could well walk in off the street. I'll come to that in a minute, all right? Because I think there's an obvious question around that. It could also be from Ambulance New South Wales, and again, we've got protocols in place with them. With the emergency departments, again, our colleagues in Prince of Wales and also Sydney Children's, and we've been having some very collaborative discussions with them. Also with the virtual emergency departments, virtual kits that some of you will know about, with Health Direct. And of course, this last one is particularly important. It's also about referral from other GPs for the attention to urgent minor injuries. What's really interesting is that if you have a look at the data, and I have, look at the data from Victoria, about 5 to 10% of all referrals to the urgent care clinic actually come from fellow GPs working in neighbouring practices. So there's good support from, if you like, neighbouring GPs who see the benefits of having an urgent care clinic nearby to be able to attend to those sort of urgent minor injuries that they perhaps don't have the time to be able to address. Next slide. So in terms of staffing, the staffing will be a receptionist, of course, there'll be a registered nurse who will help with the triaging. Now, the registered nurse will also do, as I've mentioned, the triaging. That's particularly the case for those people who are walking off the street. Now, I'm going to make some more comments on this as well, but there is criteria for use of the service. I want to make that absolutely transparently clear tonight. If you're walking off the street, it doesn't mean that you are going to receive care in the urgent care clinic. You will be triaged. And if assessed as appropriate, then you'll get the high level of care that you can expect. However, if you're not assessed as meeting the different triage categories, then you're referred and supported to receive the care from your usual doctor, or else a GP will be found for you. The other thing with 4Health is that we hope in the not too distant future, no pressure for health, but there'll be a nurse practitioner who's got great triage experience and also experience in with pediatrics. That is really critical, given we've got the City Children's Hospital just up the road, about 2.4 k's up the road. Haven't walked it, but I've driven it. And we've also got GPs who've got ED experience. That is also critical. So they've got up-to-date urgent care experience. They'll have extended skills in urgent care. And again, some of those GPs that have been recruited by 4Health have got pediatric urgent care experience as well. So again, it's an extra bonus, if you like, an extra safeguard, or an extra way of providing care and support to those parents, those children who may attend. 4Health will also have access to a pool of on-call GPs for surge capacity. One of the reasons as to why we were pleased to partner with 4Health is because they are a corporate, and corporates offer a number of quite significant advantages in this context, which is the ability to be able to source, and we know how tight the supply of GPs are, but having the ability to be able to source GPs is critical, right? So 4Health will have access to a pool of on-call GPs for surge capacity if needed, but not only that, they'll also be able to have access to GPs, to do the rotations in and out, because the GPs might want to do a few shifts. They don't necessarily want to work 5 days a week, some people, but they'll have access to if you like, a pool of GPs who can do not only surge capacity, but simply provide workforce type services. Staffing will be adjusted to reflect demand, and that is something that I've had discussions with 4Health about. We don't want people sitting around not being used, but likewise, we want to make sure that there's enough staffing so that people don't have extended long wait times. Right? Can I also say too that 4Health have been very proactive. They've already recruited quite a large number of GPs and also nurses. So they're ready to go, and I commend 4Health for their work in recruiting GPs and making it an attractive environment for GPs who want to attend. What we have heard, and I've had a lot of discussions around this, GPs are interested in working in urgent care because it extends their skill set, or indeed keeps their skill set in urgent care current, that they might not normally get in their normal, if you like, general practice work. Next slide, please. So what does urgent care centre look like? Well, some of you locally will know what the clinic used to look like because it's been there a while now. However, there's been a big renovation the last 2 to 3 weeks. I wish they'd come to my place because I have to say they managed to turn this around very, very quickly. It all looks quite different from when I was there about, when was it, Richard? About 6 weeks ago, right? So you can see that it's an open plan layout, lots of nice shiny surfaces. Bit of a nice clinical colour scheme there, but you can see it really is open plan layout. Next slide, please. It's got 5 treatment bays. Now, I like a bit of photography. I quite like the angle on that one. you can see those different treatment bays, and also that they'll be adjacent to the nurse's station. Okay. There's also a central nurse GP station, and you can see them looking back into those triage bays, treatment bays. Okay, again, really accessible, highly visible. You've got a bit of technology happening there on the desk, which will also help, of course. So that's what it looks like inside. Now, can I say and make an offer on behalf of 4Health that if any local GPs or practice nurses, or indeed practice managers, want to have a walk around, let us know. Okay, I'm sure 4Health would be delighted to do tours around this facility. Okay? Indeed, that's what we expect. We want to have openness around this facility, and we want to share, if you like, the facility in terms of what it looks like inside. Next slide. There's 2 procedure rooms. I don't think I can comment too much on them, but it's a procedure room. I think we all know what they look like. So yes. Now, in terms of the inclusion criteria, these are for minor injuries. And again, this is being developed. This is what is happening in other locations. And this is what, for the moment, it will be proposed for Maroubra. And again, we'll be modifying this as we go a little bit. It's around lacerations, abrasions, and some basic fracture management, particularly when little Johnny falls over on the soccer field on Saturday afternoon. So that basic fracture management, suturing and some bandaging, minor burns, leg ulcers. And again, the issue around ENT, some minor head injuries where appropriate. Just want to make the point that I've made earlier, but I'm going to make it again. Only urgent care issues will be seen. Non-urgent presentations will be out of scope. Their care will be coordinated and appointments scheduled with the patient's usual GP. That is absolutely where we're going with this urgent care clinic. So non-urgent care presentations are out of scope. They'll be triaged, but the care will be coordinated and the appointment scheduled with the patient's usual GP. Next slide, please. So in terms of minor illnesses, these are some of the things that could be seen within an urgent care clinic. Bronchitis, respiratory tract infections, eye infections, gastroenteritis, UTIs, abscesses, STIs, management of first trimester bleeding, and again, the issue around catheter insertion or change could also be included as part of the inclusion criteria for the urgent care clinic. Next slide. The exclusion criteria, well, I'm not going to go through each one, but you can see here that we're not intending for children less than 6 months to be seen, or for children who are in respiratory distress, or for really complex fractures. That's not the place of the urgent care centre. Or for post-surgical complications, or for second or third trimester pregnancy type issues. So again, only urgent care issues will be seen at the clinic. Next slide, please. Opportunities for integrated care. Integration's really key. It's part of the work that the PHN does. We think there'll be improvements, the ability to be able to integrate with local GPs, with Health Direct, with New South Wales Ambulance, and with the hospital EDs. We're developing up those referral pathways as we speak with relevant local stakeholders. And I'll put this in bold, which is patients will be connected back into primary care services with referrals back to the patient's regular GP and or care providers to ensure patients receive continuity of care. I've made it pretty clear to 4Health that the patient's usual GP is respected, is valued, and there will be continuity of care. Right? This is not about hanging on to patients. This is about making sure that the patient has an ongoing connection back to their usual GP. The discharge summaries will, of course, be uploaded into My Health Record, and, of course, the patient will get the appropriate documentation as well to take along to their usual GP. Next slide, please. I've only got a couple of minutes to go, and then we're going to hop into these questions, which I'm looking forward to. So we are looking at establishing the referral pathways through these different areas. And indeed, for local GPs, you guys probably already know around these kinds of pathways. But again, the urgent care clinic at Maroubra will be doing following those, if you like, those pathways as well. Next slide. What's really important, and what our PHN are absolutely is committed to doing, is making sure that there's appropriate governance around what is effectively a new model of care within our region. This is the first urgent care model in our PHN region, and certainly it's located within Southeast Sydney local health district region. It's the first kind there. I think there'll be more to come, but this is the first one. So in terms of the urgent care governance, which is really critical, there'll be an advisory committee that'll be chaired by CESPHN. Looks like that'll be me chairing that. There'll be hospital ED representatives. Critically, I stress this to you all, there will be local GPs involved. I won't name names, but I've already had one GP put their hand up and very keen to participate. I don't think we'll have any troubles getting GPs to participate as part of the advisory committee, and I want that. I look forward to that. I welcome that. There'll also be other key stakeholders invited as part of that advisory committee, including health consumers. That is also critical. We've got to learn from each other, learn from the local community. There'll also be local working groups established. Again, local GPs, Ambulance New South Wales, hospital ED representatives, that working out the different protocols. There's also been a federal urgent care operations group and community of practice that has been established, and that's got representation of a large range of different groups, including RSCGP. There has also been statewide clinical reference groups and communities of practice. It's also been set up in other states, and I expect that will happen here in New South Wales. There's also an RSCGP urgent care clinic specialist group that's been established, and no doubt also there'll be development work in terms of training and support of GPs wishing to extend their skills in urgent care. The other final critical thing is the contract meetings that will be held between 4Health and CESPHN. And they are absolutely critical contract meetings, because that's where 4Health get to tell us their progress. And we say, yep, you're making good progress, here's the money, or we've got concerns, etc., and we manage that relationship. 4Health will not sit on the advisory committee. 4Health, however, will present to the advisory committee. That's a crucial difference I want to highlight tonight. We think it's important that the advisory committee supports the implementation, but not only that, provides guidance to achieve success of the urgent care centre, provides that advice back to 4Health to localise the urgent care centre to make sure we're meeting local community needs. And also responding to the issues that local general practices and allied health providers, etc., will raise. Next slide, please. 2 more slides to go, everyone. What we intend to do now is to obviously undertake a range of different community engagement strategies. We think, and we're doing this in partnership with the Commonwealth Government. Again, we will establish the advisory committee. That is critical, and also of those different local working groups. Now, next slide, that might be my last one, I think, team. So look, thank you for allowing me to brief you on this tonight. I'm grateful for everyone's attendance. And what I'm going to do now is, just bear with me, everyone. I'm now going to try to respond to some of your questions now. If I'm not able to answer all of your questions, don't worry too much, because what I'm going to do is we will provide a response to all questions that were received tonight. We'll try and do that within a day. I've got some colleagues online who will help me do that. And so I'm going to take some questions now, and I'll try and address them. And those that can't, then we'll send you answers out in the next 24 hours. Now, there's going to be no order, but maybe if I can take some of the easier ones. There's a question here, which is the urgent care centre only built in big medical centre? No. The answer to that is no. There's lots of opportunities for different size medical practices to run an urgent care centre. And again, we were very open to that. For us, it's around capacity. Right? It's around capacity and the ability to be able to have the skills and the infrastructure to support an urgent care centre. That can be done by a large corporate, or indeed it could be done by a smaller practice as well. It depends upon the situation. We also have another excellent comment in the chat, which is that a typed letter given to a GP after discharge is not acceptable. We agree. So we'll be making sure that there's very, very strong links in between the urgent care centre and the GP. And ideally, what we'd like to do is be able to make some phone calls as well, in addition to that of My Health Record. And I respect the person who's posted that deeply, that question tonight. And that's something that I've had a large number of discussions about with 4Health, to make sure that GPs, local GPs, are kept fully informed. That would be the issue of referrals, can I say, I can foreshadow now that will be almost at top of the agenda when the project advisory group gets underway. The issue about communication back to local GPs is absolutely critical, because without your support, well, we need it. So the issues about referrals and communication back to local GPs, you can almost put it as agenda item number 1, perhaps. And I hopefully that addresses that issue. I'm just going to scroll up now, because I'm on a bit of a roll now, because I've answered the first 2 reasonably well. Let's see how I go. So one of the comments here that's been, just going to keep on scrolling here. So yes, the referral pathways will be posted on Health Pathways. The PHN supports the Health Pathways team. So absolutely, we'll be posting that on Health Pathways. Health Pathways is absolutely critical. And I thank the person who raised that question. I meet regularly with the Health Pathways team, probably at least once a week. And we'll be speaking to their GP clinical editors. Now, the other question that's arisen is, who will ensure non-urgent cases are not seen and referred to the usual GP? It's a great question. There'll be very strict protocols established, and there'll be a triage process. It's not like someone can walk off the street and go straight and get care. That's not the way in which this will operate. All right. So again, there'll be a triage protocol, because the other thing too is important to note is that the urgent care centre won't have the capacity to see everyone. All right. That's why the cases will have to be triaged to make sure they're truly urgent care, and hopefully that goes some way to addressing that question. The other question that's arisen is around, how do we make sure that patients won't be coming back to the urgent care centre? Because what will happen is that there'll be really strong communication protocols in place between the urgent care GPs and the person and the patient's regular GP, and attendances will be monitored. It'll be based on need. So that's, and I think it's also around the issue around patient education as well, to help the patient understand what an urgent care clinic is, because there'll need to be some, can I say, I don't mean this sort of upskilling or some communication, because this is a relatively new service. Patients, understandably, or the community will need to be supported in how they use the urgent care clinic and for the kinds of conditions. And also, most importantly, about the role of local GPs. That people may think that local GPs are flat out and therefore I can't get in, I'll just pop down to the urgent care clinic. Well, I have to say to you, in my experience, most GPs who have long-standing patients will try and fit them in if there's an urgent care need, or if there is a need, right? So again, I'm pretty confident that we'll be able to manage that. Just scrolling up again. Well, the question is around communication to the centre. One of the things that we've really tried to emphasise tonight is the issue around communication. And one of the things I've had discussions with For Health about is that they need to be accessible to local general practices. And again, the issue about communication, the issue about referrals, I think will be the top agenda item when this project advisory group gets underway. We also want to make sure that it's properly staffed. So there is the capacity for the receptionist to be able to respond. And not only that, for the GPs who are attending also to be accessible to local GPs, because sometimes GPs want to talk to GPs, as they should. So again, it's also about setting up those links. In my discussions with For Health, the issue around communication is absolutely critical. And so I think what they've said to me is that if local GPs also want to be able to do some shifts in at the urgent care centre, well, I think For Health will be very interested in getting access, right? And getting your services, because this is about improving the communication between local GPs and the centre. It's not like there's, it's sort of that there won't be interaction. We hope that local GPs might decide to be able to do a couple of shifts in the urgent care centre, right? And if that's entirely an option. And indeed, given issues around supply of GPs, we really want to maximise the use of that GP workforce. And also it's about supporting GP skill retention in urgent care as well. Now, yes, there will certainly be encryption in terms of communication back to the GP. Now, in terms of making sure that that we want to make sure that the urgent care centre focuses on urgent care cases. It's not about taking away patients from existing practices. No one has the luxury for that. We think that the urgent care centre is going to have sufficient capacity, but it won't be able to see everyone. And neither should it be. And not only that, it'll only see those who are urgent. So for, so general practice will continue on seeing the usual range of cases. The urgent care centre will not have the capacity to do the sort of work that local GPs are doing. It's not set up for that. It's looking after urgent care, right? So again, we have made it very clear to For Health that there'll be stringent triage categories in place, but they'll be seeing, if you like, different people than what usually turn up in general practice. So it's sort of like different patient groups, if I may say that, right? Different patient groups, different patient needs that the urgent care centre and GPs are trying to address. So in terms of poaching of patients, I think I've tried to address that. Can I say to you, that's been perhaps one of the first items that I had discussions in with For Health. What we have found, though, is that there's actually quite a few GPs who actually refer into the urgent care centre to help support their patients who have urgent care needs. So again, there'll be times when it's actually local GPs will find it of tremendous value having an urgent care clinic nearby that they can refer patients. It might have someone who's got, some timber up one of their fingernails, for example, that might take quite a bit of time to get out or to address. They could be popped down to the urgent care centre, the referral from the usual GP, attend to that splinter up the nail, and then back to their usual GP. So it's those kinds of things that we think could offer benefits to local GPs. And also avoid the poaching of patients. Again, the centre simply won't have the capacity to be able to take on the usual workload of GPs. And I also understand that local GPs in the Maroubra area are also extremely busy at the moment, right? But again, they work hard at trying to see the usual patients if they have to. Now, the issue about it closing in at 8 p.m, that is a great question. As I indicated in my presentation, I would hope that we could extend those hours beyond 8 p.m. over time. What we are going to do is have a look at the data. Also, under the National Health Reform Agreement, patients have a right to get care from an ED. Some patients might well prefer to wait at ED to get their care, and that's okay. But there'll be some patients who might say, well, instead of driving to ED, there's an urgent care centre nearby, I can perhaps go there. That's how it's going to take the load, particularly if it's, it's operating 7 days a week, it might be 7 o'clock at night, rather than go to ED, they'll make a conscious decision to be able to go to that ED, to go to that urgent care clinic. And again, we do hope that those hours will be extended. It will also be open 7 days a week as well. And the other thing too is, we've also looked at the experience of what's happening in Victoria as well. And we also note too that often some of the busy times for urgent care is actually not at night time. Some of it's actually in the daytime as well. There are particular time periods that we've seen in Victoria that we think will be replicated up here. I think it's around from about 10 o'clock to 11 o'clock in the morning. And then from about 6 to 8, we know that that's when a significant number of patients actually require urgent care. So it's not those arriving at post 8 o'clock at night. It's actually between, mid-morning and also between 6 to 8 o'clock. That's when the majority of patients identify that they've got an urgent care need. Now, additional qualifications that employed doctors have. I might take that one on notice, if I may. We'll come back to you on that. It's not so much additional qualifications, if I can say that, rather that they've got experience in the area of being a GP. That's good enough. But not only that, we think over time, there'll be different urgent care training that's provided to better equip those GPs who decide to specialise more in the area of urgent care. So it's not a bunch of additional qualifications. It's more, if I can say, the experience of urgent care. But again, you would expect that as urgent care starts to develop more, there'll be urgent care qualifications that'll be developed. Just now, we've got 9 minutes here, everyone. So I'm going to do my best to try and answer as many as I can, all right? And the team are also messaging me at the moment, so I'm trying to keep my answers reasonably brief. So in terms of whether this is in direct competition with local GPs, we would sincerely submit that it's not, because they're looking after different kinds of patients with different care needs, and they'll be triaged. They also won't have the capacity to do what local GPs do well. And we also want to make sure that that it's also about responding to local community needs as well, right? You know, it's not the best outcome to have patients waiting in ED for low acuity conditions for many hours when they could be seen locally by, if you like, what is effectively a bit of an after-hours GP and an urgent care centre, be able to get their needs met reasonably promptly within their local community. So that's how I would say it's not in direct competition with local GPs. I can understand that. I've heard that comment many times, but we're aiming for this to be complementary, absolutely complementary to local GPs. And again, can I say to you that as part of this project advisory group, the steering group, that'll be one of the key things that we'll be looking at, which is what are the impacts on local GPs? We actually want to know that. We want to know what are if there are going to be any impacts on local GPs, what are those impacts, and what can be done, if you like, to make sure we've got to tighten up the triage categories perhaps, or improve communication. There's going to be a range of quality improvement initiatives that we're going to have to undertake to better localise our service to make sure it works and well with local GPs. And that is our commitment, can I say to you? That is the whole purpose of the project steering group. Okay, that is why that is our commitment, right? There's going to be some range of quality improvement exercises that we need to do. Well, in terms of 4Health, I'm not going to address one of the questions there. All I will say is that one of the things about 4Health is that we have been really clear that we expect extremely high levels of service delivery. We expect that they will have modern, up-to-date IT. Indeed, that's one of the reasons as to why we're doing the bit of the checklist tomorrow, and that they will have software systems that are modern, updated, and are integrated with general practice and be able to communicate with local care providers. That is absolutely critical. And the reason as to why I'm confident around that is because we now have a contract in with 4Health, and we've made our expectations very, very clear. Can I say to you, this is a contractual arrangement that we have with 4Health, and we have very strong expectations in relation to those commitments that 4Health have given us. I'm also pleased that 4Health does have experience, and they've had learnings from other urgent care centres across Australia. Now, we've got about 5 minutes to go. I'm just quickly scrolling down to see if there's any additional. So someone's asked a really great question, and I won't name the person, which is, how will you ensure that the clinic will be staffed at all times by doctors? Yes, because there is a yes. We give that commitment because there is a minimum staff standard that we've set as part of our contract. So it will be GPs will be present in that clinic at all times, right? Now, what we'll be able to do is to do some surge capacity as well, and that's one of the benefits of going with a larger provider such as 4Health. And my understanding is that they've had, and I've had discussions with other providers as well, that they've had really strong interest by GPs wishing to work in urgent care. I was surprised by that, to be honest with you, but they've had very, very strong interest. They've already recruited, my understanding is they've already recruited a large number of GPs to work as part of the Maroubra practice. Some of them are local, can I say to you, and we think that's really good as well. We'll be encouraging other GPs to be able to work in that clinic as well. So yes, it will be staffed at all times by doctors. Whilst we love nurses, it won't just be nurses. It'll be nurses as part of part of that primary healthcare team with doctors front and centre. We are working out some issues around access to New South Wales health information, so I might take that question offline in terms of CEP. It's a great question, so we'll take that one offline and we'll get some. My understanding is they will, but I'll take it offline. I don't want to give you a wrong answer tonight. So in terms of when it's going to be opening, we are aiming for a soft opening for in the next week, depending upon, we're doing the checklist tomorrow, but there'll be a very soft opening about testing out systems next week. But again, we've got a range of other consultations that we also need to do, and it will gradually start to develop from there. All right, and the centre has been renovated, and I've showed you some pictures there tonight. It looks pretty smick. It needed to be, and so that's sort of, there's a few things we've got to iron out, and we're doing that. And again, we've got our I forget the correct term now, everyone, but if you like, the checklist or the meeting tomorrow with the specialist GP is going to be conducting, I think it's like 4 or 5 hours, walking around the practice and examining all the documentation, etc., like that. That's going to be a big day tomorrow, all right, to make sure it's fit to open. We want to be transparent around this urgent care clinic, and I think For Health want to as well. So we will be providing some updates in terms of usage. I think that's key. We want the service to grow once it's established, but it'll grow slowly, all right? It'll grow slowly and build up over time. But what's really important is that we start slowly and build up and earn your trust from the local GPs. That's what's really critically important, right? Earn that trust by walking the talk, walking some of the things I've said tonight. There's about 8 For Health people on this call tonight. They're hearing me. I'm getting a message back from them. They've heard me. So we want to be very transparent around the service and providing as much information as we can to local primary care providers. Now, we're at 8 o'clock here tonight, and I would say to you that we're asked a lot of questions tonight. In terms of maybe the last one then, perhaps, someone's asked me what specific priority populations you reference to. Well, it'll be those priority populations that include First Nations, those people who are perhaps in social housing. It'll be those people who English may not be a first language, those people with mental health conditions perhaps who may require some additional support. So those are the kinds of specific priority populations that will make sure that the centre is upskilled to be able to manage as well. Okay. Now, I think all up we've had, move my how do I do that? Oh, I've got it now. So we're coming to the end of our questions tonight. I haven't addressed all of them, but what I am going to do is we've taken a note of all of them. We are going to be providing a response. So I want the response back within 24 hours. Yes, my team will be working hard on this tomorrow, but we think we're going to be able to do that, and we'll send it back to all of the people who have attended tonight. Can I just say that my deep appreciation for all the work that local primary care providers are doing. I'm really grateful for all that you do. I'm also really grateful for a number of you who've reached out to me and have indicated support for the urgent care clinic. I'm grateful for that. You've had some very frank conversations with me over the last couple of weeks, and it's been we've had some really productive, I think, collaborative discussions on that. And people, from what I can see, are broadly very supportive of the Urgent Care Clinic. And I've been really heartened by that. Indeed, not just broadly supportive, but actually welcoming it as a way of providing increased levels of service to the local community. So I thank you all for that. Can I also say thank you to all of you for attending tonight and for giving up your time. It's not easy when people are so busy. This will be the start of a regular conversation that we'll have with local general practices. This is not the first, and this is not the only discussion that we'll be having. We'll be having a number of discussions with you, keeping you informed, keeping you involved. You've got our commitment on that. This is simply, if you like, the first sort of discussion that we're going to have with you, but there'll be other opportunities. And I'm more than happy to take any phone calls, take any emails, any concerns. I think we can address them quite quickly, but also to really hear if there are any improvements that need to be made. Really open to hearing any of your suggestions. So once again, can I wish you good night? Can I thank you all for attending, and thank you to everyone who's answered a question. There's so many good questions, and again, we'll take them on notice, and we'll get something back to you within the next 24 hours. So my thanks to you all. Can I thank you also my team, my CESPHN team. Can I also thank the 4Health team as well? I'm grateful for all the work that they've done in helping prepare for tonight. So thank you, everybody, and I wish you a really pleasant evening.